Many of us have received a surprise medical bill at some point. That is one that's been overinflated by hidden costs and fees. They're not fun, and even though surprise bills are now illegal in Colorado, patients are still getting them.
As KRDO 13's Josh Helmuth recently found, errors and overbilling are more common than you think. In fact, those charges are often clouded in confusion, leading patients like you to pay the price. Thankfully, he's ready to share some valuable secrets in tonight's special report, Prescription for Savings.
Lindsay Lohr works in healthcare, but ask her about her views on working with health insurance.
Not great.
She has stacks of papers defending one bogus medical bill.
This is basically all the information regarding my claim. This is my evidence.
Lindsay's story is a tale as old as American healthcare time. Just ask Manat Singh.
The system is doing what it was designed to do.
She runs the Colorado Consumer Health Initiative. Its sole purpose is to crack down on deceptive medical bills, which they see a lot of.
The system itself is rigged against being able to receive care when you need it, affordably, in a way that keeps people healthy.
CCHI also helps patients identify junk fees, saving you money.
New fees that are getting tacked on to consumers' bills that cover admin costs, that cover other things that we believe are just transferring the cost to the consumer, where the healthcare system is kind of failing to kind of cover those for themselves, or an effort to increase the cost of care to collect more money.
100 million people in the U.S. have some type of medical debt, but some of that debt can be avoided or nixed altogether.
Some people can get charged an out-of-network rate even when they aren't allowed to be charged that. Sometimes you'll notice that there's a test that you never had, or that they've billed you twice for something.
Sometimes there's simply billing errors, so checking for mistakes is your first step, assuming you've stayed in network for your treatment, making sure you're billed as such. Also, call your provider and your insurance to make sure nothing has been miscoded. But even if the bill is 100% legitimate, your next step is to negotiate down. Most hospitals and providers will be more than willing to lower your bill if you know what to ask and how to ask it, especially when it comes to hidden fees. In fact, some will lower your bill if you can pay in full. And if you think you might qualify, ask if they have a financial assistance program. Colorado law says nonprofit hospitals must provide assistance to people with low incomes. Also, keep in mind, if you're paying cash, you have the right to a good faith estimate, and you can dispute any bill that is $400 or higher than the GFE. Also ask for an itemized bill. Each charge should have a clear, reasonable explanation. Never put your medical debt on a credit card. The interest alone will further bury you financially. And if your insurance company denies your claim, file an appeal. If you are rejected again, reach out to the Colorado Consumer Health Initiative.
Also, use tools that reference what medical costs should look like. The Patient Advocate Foundation has free case management and applications for possible financial aid. Meanwhile, Fair Health Consumer, they have a tool where you can actually look up real costs of medical visits and procedures in your area to make sure you're getting a fair shake.
And if you haven't noticed already,
I was really good about taking screenshots of everything.
document everything.
Yeah, I'm a little bitter, but I'm glad it worked out in my favor in this situation.
Josh Helmuth, News Channel 13, Colorado Springs.
Makes me wonder if I've been a victim and not even known it before.
Unaware.
Just for not checking. Wow. We have collected some great tools and resources for you, including how to shop for an affordable provider in your area.
And for links to all of that, you can check out Josh's story on krdo.com.